Just quick introduction. My name is Brad Defenbaugh. I'm a physical therapist, sports clinical specialist, and specialty areas in golf. Basically, the way that you go through physical therapy, you go through undergrad, grad school, and then possibly take a residency. And then after you're done with all that, you have the opportunity to subspecialize. And I decided to go the golf route. I've been a longtime golfer. Always had an interest in it. I would say that as much as I try, I can't really golf enough to lower my handicap too much, but my interest is in more of the biomechanics, as you can imagine, from a physical therapy standpoint. My interest is in more of the biomechanics, and I'm a much better teacher of movement than I am a coach for myself. So my skill in golf is not indicative of my skill in biomechanics. But I still like going out there. I have fun every time that I go. And I've done a number of these talks. Everyone's a little bit different. So I just want to kind of give a little overview of what this talk is going to be like. You can post a message in the chat as much as you would like. I'll get to everyone's questions. If you feel more comfortable unmuting yourself, we could certainly do that at the very end when there's question and answer. So think about the chat as more of a, I don't want to forget this sort of situation. And then the unmuting at the very end, we'll do as more of like an open forum of things that you're hoping to get out of the presentation, or things that I didn't cover that you're hoping to get out of it. You can put that in the chat or ask that at the end of the presentation as well. So the way that I like to talk through golf as it relates to physical therapy and health in general is there's a number of different issues that you can have during a round. So a lot of people have inevitably watched the Golf Channel, and they typically harp pretty heavily on the strength and mobility side of things. I think they're going towards a very specific crowd, but for a lot of us golfers, myself included, I run into kind of the very basic issues beyond swing path and contact point, smash factor, all those sorts of things. I run into I'm running late to the golf course before a round, don't have time to warm up, don't have time to hit the driving range, I haven't eaten anything. And that all impact, like you could have the greatest preparation over the past 3 months of strength training and mobility, but if you don't have the good fuel to get through a round, then that might be the thing that's limiting you. And sometimes people don't think about that as a factor, but we'll definitely talk through how you go through a round, how you prepare for a round in its entirety, including nutrition and kind of preparation beyond the stretching and the exercises. So looking at the slide here, we have 6 different areas that I like to highlight. So we've got the fatigue side of things, pain, tightness, mental fatigue. So the first one being physical fatigue, hunger, and weakness. So the physical fatigue happens for a lot of different reasons, like I just mentioned. Could be diet, could be nutrition, hydration, all those sorts of things play a role, but strength and mobility also are one of those areas that you can improve on and make some significant gains if you're struggling with that. Pain is the one that I see most commonly, because usually people don't want to stop golfing unless there's pain or something limiting their game. The first thing that people come in with is not usually, oh, I want to get 2 strokes off my handicap. It's more, I was doing fine, and now I have this shoulder problem that I have to deal with, and now I'm hitting the ball as far, I'm inconsistent, what's going on? And pain can come from a number of different areas that we'll go into a little bit later. Tightness, that's one of those factors that go along in with muscular fatigue. You can sometimes run into fatigue due to your hips tightening up, your back tightening up, so your body's trying to fight that. The weakness side of things, it's also the power that you can produce. So if you're talking about a single drive or a single shot that you need a certain amount of distance for, or even a control situation where you're on an uneven lie and you're trying to hit a controlled shot onto a green from, let's say, 150, 200 yards out, you need a certain amount of strength to do that. Even though it's not swing as hard as you can, you still need a stable base to address that. And then hunger. So this is another one that if you're running low on fuel, that's why if you ever watch a PGA Tour event, they're constantly eating things. They're constantly drinking things. Hydration and food are the two major components of keeping up your energy during a round so that you don't run into the last one, which is mental fatigue. So if you've ever gotten to past the turn, you don't make a stop for any food or water or anything like that. You just kind of push through because you're running behind. You hit hole 13 and you're like, oh my gosh, 13 holes. I feel like that was enough. Like I'll push through the last 5 holes just because I paid for it, but I'm checked out. So those are kind of all the issues that when you look at the entirety of a golf round, I think those are important to highlight. So let's talk about physical weakness first. So usually with this, it can come in many forms, and it's most commonly addressed on the Golf Network. They have hundreds of different exercises to improve strength in your hips, upper body, forearms, all that sort of thing. Hip strength or hip weakness, core weakness, and then the just overall dynamic stability. So dynamic stability meaning at address, you should be able to hold that position as long as you need to, but you're going to need a series or a sequence of muscles to fire to be able to hit the ball where you want it in a controlled manner with relatively high amount of speed. One thing that people don't necessarily think about is grip or forearm weakness. It's very hard to evaluate or pick up on when you're just golfing. The reason that this is important is if you're anywhere but the fairway, you're going to run into a little bit of resistance, and that club is going to grab on the grass depending on where you play. And if you don't have that grip strength where you feel comfortable having like that perfect pressure on that lead hand, you can over grip or you can under grip, and both of those lead to elbow tendonitis. You can sometimes get a little bit of a low back injury or rotator cuff strains because you're trying to compensate for that grip strength by pulling in other muscles. So something that people don't necessarily think about all the time. Fatigue overall, this is probably the easiest one to diagnose. If you're going through a round and your typical thought process is, man, looking at the scorecard, the first 9 holes, I'm doing great, and then once I hit the turn, I just bogey after bogey after bogey or whatever the goal is for you. You just notice that tapering off as the round goes on. So fatigue usually comes from poor hydration, poor nutrition, all those sorts of things, but it can also be poor preparation for the round as well. So it could be that you are sitting for most of your day and now on the weekend you play your round of golf, and that's the only time that you really utilize your body in a quick movement scenario. And this is probably the most avoidable or the most correctable situation to address. We also have injuries from fatigue. So again, the wrist sprains and strains, sometimes fractures. So if you're getting fatigued, mental or physical, and then you just chunk one into the ground, that's when you get cartilage issues, wrist strains, all those sorts of things. Low back injury for the same purpose. You catch something thin that you feel like you're gonna, to hit square. Your body's not ready for that. So you definitely need to be able to slow that swing down after you've made contact, or else you'll hurt something. And then the emotional injury, which we can definitely relate to for all golfers, of just wrecking a great round. So it definitely comes into play where you're just having a great round, and then you finally look at the scorecard, you're like, oh my gosh, I have 5 holes to go, and like I'm doing great, but then you're cashed out. So all those things can play a role in your score and just your general, the fun that you can have during golf can sometimes be limited by that. Tightness, this is definitely one of the ones that is hammered quite a bit on the Golf Channel for good reason. But I always make the caveat of tightness usually comes in with weakness of another muscle group on the other side. So if you're sitting in a desk for a long period of time, then your hips are probably stretching out, but the back side of your hips are probably stretching out quite a bit, but the front side of your hips are tightening up quite a bit. And if you've ever tried to get your hips through the ball when the front side of your hips are tight, it's a struggle. And the worst case scenario is one hip is a little bit more mobile than the other one, and then that puts a little bit more torque on the low back. So, like I said, comes from having a desk job. You can have tight hip flexors, forward flexed upper back, tightness in the chest. But you can also have tightness as a manual laborer. So, like both sides of the spectrum, you can have tightness in the low back because you're standing all day, chest tightness because you're using your arms to do a lot of different things, and then connected to your shoulders, your neck. And when you turn your shoulders to try and get down for the ball, if your neck's tight, then your head starts to go with your shoulders. So all those things can lead to cervical strains, herniated discs, and then general poor control overall. So the hunger and thirst part of it, just to give a little clarity to what you might have heard or what you might have seen on TV, the goal for a typical round is that you have just kind of an even blood sugar level throughout the round. If you feel yourself getting low or high, then you're kind of losing control of the situation, so you have to kind of right yourself. But in most cases, if you're eating things like trail mix, nuts, water with a little bit of the powder IV solution that you can get from Costco, all those things are usually pretty good. Gatorade is one of those that you can really get out of control with. It does have a lot of sugar to it. If you do want to drink Gatorade for the flavor or to just kind of have something other than water, I would either have a water bottle that's twice the size of whatever Gatorade that you're using, dump it in there, and then fill the rest with water. That usually dilutes it down enough to where it doesn't give you any sugar spikes one way or another. Small snacks throughout the round, like I said, like the trail mix or like half of a peanut butter sandwich or something along those lines that's not going to really force your body to try and digest it and sit in your stomach. That's probably the best option. And if you have coffee in the morning before getting to the course, you should probably have 1 or 2 cups of water to offset that. And a typical amount of water to drink during any day is about 12 cups of water. If you do activity, slightly more than that. Okay, the mental fatigue side of things. Some people struggle with this more than others. Some people care about this more than others. So depending on the goals of your round, if you're just trying to go out and have fun, then make a mental note of that's the goal of the round. So if you're going out with, like, this is the first time going out for the season, or you're going out with a bunch of friends or something along those lines, that's not the time to be extremely hard on yourself, because that just, it spirals. Once you have a bad shot and you get upset with it, then you start to kind of fatigue out. If you can set a goal of what you're trying to do before the round, and hopefully it's a reasonable goal, that's kind of the best starting point to reduce the mental fatigue side of it. And also, if you don't have any expectations of the golf round, then it's good to just kind of make a mental note of that as well. So set realistic expectations, identify what you want to get out of the round, stay hydrated and fed, and then understand that the main part of golf is to improve. So I don't know too many golfers that would deny that the reason that they come back to golf round after round is they're trying to improve. And depending on how much practice you put in between rounds is kind of what you can expect. But I think it's kind of inherent. If you love golf, then you love to try and improve every round. Okay, so pain. So this is the biggest one that I see as a physical therapist. It's the most noticeable and tactile symptom that we can kind of tell to a medical provider. So pain can range all over the board. So what I like to say is there's like the pain, sharp, dull, shooting. All these are good descriptors of pain, and depending on where the issue is, you'll have different symptoms that go along with that. So that's why a physical therapist is one of the better people to address pain, or what we look at as biomechanic issues. That pain is coming from somewhere, and we can definitely tease out if it's a biomechanical thing during the swing, or something leading up to it, or something that's just not moving well, or is it something else? So a lot of the misnomer is that if you go to physical therapy, then you're kind of stuck in physical therapy. I would say that physical therapists are probably the most likely to direct you to the right person if they can't help you. So we have a large swath of a network in the medical community: chiropractors, massage therapists, acupuncturists, physicians, naturopaths, and we connect to all of them. So it's one of those things that if you do have a question, just see a physical therapist, get an idea of what you're dealing with, because pain is usually just the warning sign of something's going on. So usually when you're talking about pain, you're also talking about a multitude of things. So everything that we talked about before this slide, the strength issues, the weakness, the tightness, fatigue, all those sorts of things can lead to pain. It's just a matter of what is treatable and what's not. So really the only person that knows that is a medical provider. So looking online can, sometimes you might get lucky, but it's always worth a checkup with someone that knows a little bit more and can give you some context to it. So just a typical rundown of what different types of pain indicate, just so that you're a little bit more educated on it. Pain that gets worse through the round, usually it's a weakness or a movement issue. So you're straining a tissue more than it wants to be strained. If pain gets better through a round, usually you're talking about something that is a tightness issue, flexibility issue, or tendonitis can actually also present like this. Because you could think about tendonitis as you have a lot of tightness and scar tissue built up around a tendon, And then as you're getting blood pumping through it, nutrients pumping through it, it starts to feel better until after the round or the next morning. That's when it starts to feel a little bit worse. And the pain that just stays the same overall, usually that's osteoarthritis, but not always. That's just, these are just very general situations that you can run into. Okay, so as a summary, as you progress through a round, there's a lot of issues that can prevent you from performing well. You guys should have a better idea of how to handle these, how to differentiate them. And worst case scenario, you go to a physical therapist and they give you a little bit more context to it. So I just wanted to talk you through all of that before I opened up for a question and answer, because number one, hopefully that spurred on a couple questions that you've been struggling with. And it just kind of gets us all on the same page of what topics are appropriate for a physical therapist. So maybe you didn't know that physical therapists deal with mental health issues, deal with nutritional issues, all those sorts of things. We don't do it from a clinical standpoint, but we have a little bit of experience in all those areas. So I'm opening up the floor, and I'll do a little bit of navigation on the mute unmute situation if we have a lot of people wanting to ask a question at the same time, but go ahead and just unmute to ask your question, and I'll just kind of give you 15 seconds before I start talking about a question that I got earlier. Okay, cool. So I got a question about adhesive capsulitis or frozen shoulder. There's a lot of different reasons for frozen shoulder or adhesive capsulitis, and they're really not sure what is the underlying cause of it. But in a golf swing, frozen shoulder is really, really difficult to deal with. Depending on the shoulder, if it's your right shoulder and you're a right-handed golfer, when you take the club back, you're basically getting into a situation where you can't externally rotate. Your hand's going to be a little bit more forward, and then that forces you to turn a little bit more. And without that flexibility, you're going to feel limitation in the ability to get the club on plane, and you're going to have a hard time not coming over the top and slicing the ball. So if you have frozen shoulder, it's one of those things that research has shown over time it does get better, and you have to nudge it in the right direction. But it's one of those things that there's not a package of exercises or anything really definitive to get that fast tracked. Something that also is worthwhile noting, whenever you have a shoulder issue, you can always go to the thoracic area, so kind of upper chest and upper back. Something that we like to do in physical therapy a lot is foam rolling. If you do foam rolling in the upper back, that is almost like a workaround for a shoulder injury, because it frees up a little bit more motion when you're taking the club back and when you're trying to accelerate it through the ball. And again, if anyone doesn't want to unmute themselves, if they want to write something in the chat that they're hoping to get out of this, they can certainly do that.
I'll ask a question.
Yeah, sure, Kimber.
If you do a multiple of exercises, so you do core, you do balance, you bike, you treadmill, arms, is there anything specific that you need to do for golf? Or as long as you do a variety, do you have to worry about specific golf exercises?
Yeah, that's kind of a joke that I usually talk to PTs that don't know much about golf. There's like the Golf Network version of exercises, which is just like all the exercises that we do in physical therapy with golf in front of them. So everything that you just said is perfect. You hit core, endurance, shoulders, hips, all that stuff is great. One thing that I would mention is even though you've worked on all those things, it's probably good to do some sort of rotational combined motion. And there's a bunch of them out there, and I'm sure we have your email address. I can send you a few of those. But sometimes if you're, depending on the exercises that you're doing, if you're doing like a shoulder exercise or a hip exercise and you never do like a kettlebell carry or like a rotation with a band, those muscles don't know how to sequence themselves together. Sometimes you get lucky, and depending on how much time you practice, you'll notice, oh, I'm able to kind of hold my position or hold my balance a little bit better. But yeah, like one or two, I guess you could call them golf related exercises, or what we like to call dynamic exercises, are very appropriate to tie everything together. But I mean, you've done all the hard work. It's definitely more of a like putting the bow on top for sure. Great question.
That would be great if you wouldn't mind sending those to me. You should
Yeah,
have an email address.
I think so. I think so.
Thank you.
Yeah, no problem. Anybody else have any questions? Anything that they have heard about or seen about? Just jump in if you do. One thing I also want to touch on is devices. So like golf devices. So you've got like the Orange Whip, you've got Super Speed, all those kind of like weighted swing programs. Be very careful on those. If you're not prepared for it, it can really hurt you. Definitely warm up. Treat it as a plyometric exercise. It's not something to just go in cold without warming up. They are effective, but they're effective if you can kind of work through the process of getting yourself a little bit stronger and not starting out at the heaviest option. Okay, great question. So with a question, how much time is appropriate for a warm up? So I'll give you kind of the spattering of what people typically do. So for pro tour players, they're kind of the gold standard, right? So they get to the course 2 hours ahead of time. They do a just general kind of walking around, warming up, maybe a little bit of jogging if they need to do that. But they'll do a dynamic warm up, a little bit of static stretching, like a hip stretch or something along those lines, but very minimal on that side of things. And if they have a massage therapist or a doctor that travels with them, they'll have a session with them if needed, just to check trigger points, things like that. They'll loosen up muscles with a lacrosse ball or mobilization ball, foam roller, that sort of thing. And the one thing that may surprise you is if all of that takes up the time, like if for some reason the day before just wrecked their body and they just need a lot of warm-up time, they'll skip the driving range. That's something that they can put on autopilot, which I feel like for most amateur below golfers, the driving range is kind of the thing that we need to work on the most. But honestly, if you don't have it down and you're just trying to figure it out on the driving range before a round, it's probably not going to yield the best results anyways. So for most normal golfers that don't have a gym or a clubhouse to work out in or warm up in. What I like to do is get a small bucket of balls, bring a towel that if you're living in the Pacific Northwest and you golf anytime that's not July through September, they have really good golf towels that have a waterproof bottom to them so that you can kneel down on the ground and do some hip stretching, rotational stretching. But again, you're really not doing anything advanced, or you're not doing anything quick or plyometric. And as you warm up, so after you stretch out your hips or whatever feels tight, then you get into like your 5-iron, probably 7-iron, 5-iron, 4-iron or hybrid, and then driver. And then you can kind of do wedges after that. The reason I do wedges last is you can have the tendency to chunk the ball with that, which puts a lot of load on your back, and you have to bend over a little bit more, which could also put a little bit more load on the back. So you're just kind of loosening things up a little bit. All of that probably takes anywhere from half an hour to 45 minutes, I'd say. But I would say anything below 15 minutes of a warm-up is probably not enough. Anything above 45 minutes, you're probably going to fatigue yourself out before you even get to the round. And there's definitely no like golf warm-up. That's something that you want to talk to a healthcare provider about, to tailor it specifically to you, because you don't want to go through this shotgun approach of all these stretching exercises and you're stretching out something that's incredibly mobile to begin with. Go ahead, Richard.
Thank you. I had lots of trouble with lower back. I played golf many years, but what I'm trying now, just to get more enjoyment out of it and consistency, is working with the lower part of the arc and not bringing my up to my shoulder or wrapping around my neck or anything like that. It's just that sweeping lower effect. And my question, it seems to be, I know I'm sacrificing distance when I'm doing that, but I seem to have more I seem to have the more consistency, and I know a lot of people use that for low, chip shots and stuff. But I'm talking about just getting my right side up to about waist level, and then come on through from the ground up, and that seems to work. But is there a limit to how you can do that bottom of the arc thing? And is it I guess, are you sacrificing your distance and your ability to have any kind of any kind of a game as far as distance? And I really the pain comes when I go up and then hitting from the top and all that. I really like the feel of the lower arc, and I just don't know where the limits are. And maybe you should just hit in the backyard and enjoy that part of it, and not take it out to the
yeah, I mean, I would circle
the local place.
Yeah, I mean, I would
I know you're
circle back to one of my earlier slides of like, what's your goal out of it? If it's just to go out and finish 18 holes, then yeah, I think you should definitely do what allows you to do 18 holes. And I mean, the days of this huge X factor and like shoulder and lower body disassociation being huge. I think we're thankfully getting away from that a little bit more. You look at John Rahm, he has a really short backswing, but it's all about the speed at impact. That's what gets you your distance and how solid you hit the ball. So if you're only taking the club back a quarter of the way, halfway, something along those lines, but you're hitting the ball crisp every time, I would argue that that's much better than swinging as hard as you can, having back pain, and then not hitting the ball solid. So there really isn't a limit, in my opinion, of the takeaway. You are going to sacrifice some distance, but if your goal is score at the end of the round, I would argue that unless you're dealing with single digit handicappers or scratch golfers and you're trying for whatever reason to tee it all the way back, you're gonna shoot just fine. I mean, you're gonna stay in the middle of the fairway, you're gonna hit greens in regulation, and the big thing is you want to have pain at the end of the round, and hopefully you'll have fun doing it. So that's kind of a roundabout way of saying it just depends on what your goals are, but some people can hit a ball pretty far by taking it only 20% back or halfway back. But you definitely have to get the hips involved to get that distance. It's not so much how far you bring the club head back, it's more can you turn on those hips and push through the ball.
Thank you. That's encouraging. Thanks.
Yeah. No, there's definitely, golf has so many different ways to approach it. There are certain things that you just can't avoid, and if you have some breakdowns in certain areas, you can't avoid them. But you can take the pressure off of it and prepare for it a little bit better.
Thank you.
Yep. Anybody else? All right. Well, I'm not seeing anybody and not hearing anybody, but my contact information was probably on the invite. It's also on this last slide. Kimber, I'm going to get you those couple exercises that I can think of, and I'll send those over to you within the next couple days. But if you guys have any questions, any follow-up of any kind, just please feel free to reach out. And if I can't answer the question for you, I can certainly use my network and try and find someone who can. But I really appreciate everyone coming out and spending a nice Seattle day online and listening to me. And if you need anything, just reach out.
Okay, I'd also be interested in the exercises.
Okay, yeah, sure, absolutely. All right, great. So I will send those out later on this week. Hope everyone has a good rest of their Wednesday. And yeah, don't hesitate to shoot me an email or shoot me a message. Hope everyone has some good rounds out there. Yep, no problem.